In this video, I want to talk about branches of pharmacology for you. If you don't know about pharmacology, you can click on the above link to first see the video of Introduction to Pharmacology. If you are interested of pharmacy and pharmaceuticals related subjects, click subscribe and the bell to be informed for more videos. Branches of pharmacology. We have two main branches in pharmacology, which are pharmacokinetic and pharmacodynamic. We also have other branches such as toxicology, pharmacotherapy, and clinical pharmacology. Let's learn about each of them. Pharmacokinetic, as a word, is made of two parts: pharmakon, which means drug, and kinetic, which means motion or movement. And when it comes to science, pharmacokinetic is about what the body does to the drug. Includes liberation, absorption, distribution, metabolism, and excretion of the drug in our body. How body does the process of pharmacokinetic? The process starts with liberation, which is how the medication is received by our body. Medication can be taken orally or by injection. The second process is absorption, which is done by gastrointestine. The third step is distribution, that the medication is distributed by the help of blood in our tissues and organs. Metabolism of a drug is about the breakdown of a drug, which causes chemical alternation of the drug. Mainly, metabolism is done by our liver with the help of liver enzymes. Finally, our body excrete and eliminate the drug mainly by our kidney. Pharmacodynamics. Pharmacodynamic, as a word, is made of two parts: pharmakon, which is drug, and dynamic, which is power. So it is the power of the drug. That means biochemical and the physiological effects of the drug. And scientifically, pharmacodynamic is about what the drug does to our body. So it talks about the mechanism of the action and the effects of the drugs. The mechanism of action describes how a drug produces an effect on our body by having different targets. For example, these targets can be cells or enzymes. As an example of an analgesic, that's how it works, we can say morphine. It interacts with the opioid receptors and activates the supraspinal system. So, it produces an analgesic effect. So, what is the difference between pharmacokinetics and pharmacodynamics? In pharmacokinetics, we study the absorption, distribution, metabolism, and the excretion of the drug. And in pharmacodynamic, we study the activity of the drug. Other branches of pharmacology. Pharmacotherapy is about the uses of drugs to diagnose, to prevent, and to treat the disease. And toxicology, which is the study of adverse reactions of any chemical substance. And finally, clinical pharmacology, which is a study of actions and the effects of drug. That also concentrates on therapeutic evaluations of a drug in human. Thanks for watching. Don't forget to subscribe. Please support me with your likes and comments. See you!